The commonest vaginal infection is Candida albicans or thrush. And one of the commonest conditions I see are women who have recurrent thrush. Instead of an isolated episode that they have treated through their local chemist with simple over-the-counter preparations, they're getting thrush on a repeated basis, and that results in itch, irritation, and these symptoms can be very distressing, especially if you have it 3 or 4 or 5 times in a relatively short space of time. The important thing to consider is that treating the germ on a recurrent basis isn't the answer. The answer is to eradicate the germ altogether, and what has been shown to be the most effective way of doing that is continual treatment for 3 months. We use oral medications called azoles, which are fluconazole or itraconazole, and we also use boric acid gel caps which are inserted into the vagina every night. As I mentioned, continuous treatment for 3 months results in the eradication of the germ in the majority of patients. Another thing that we tend to do is we do a special swab and ask the laboratory whether or not the treatment will work. In other words, is the Candida albicans sensitive to the treatment that we're going to use for eradication? The reason that recurrent thrush has become significantly more common is that the germ itself has become resistant to a number of the commonly used treatments. The diagnosis of Candida albicans or thrush is on the basis first of symptoms, which are a cheesy white vaginal discharge associated with inflammation of the vagina, and often with itch or irritation of the vulva as the fungus infects the outside skin as well. The condition can also be diagnosed on a simple swab test where they're able to grow the germ in the laboratory, and as I mentioned, we actually ask the laboratory to tell us what treatments the germ is sensitive to and what treatments the germ is resistant to. You should seek medical advice for your Candida albicans or thrush if your symptoms aren't improving, which may suggest the germ is a resistant germ, or if you're getting recurrent infections. Thrush is a common germ that can live in the body as a normal body germ, but you can also have reservoirs of the germ living in places like your bowel, and that can result in recurrent infections as you reinfect from this reservoir. If you're having recurrent thrush, we need to exclude the possibility of diabetes. You're also more likely to develop recurrent thrush if you're using broad spectrum antibiotics. And also, recurrent thrush is more common if the original bout of thrush is not treated adequately. The main problem about having recurrent thrush is the distressing symptoms that it causes. The recurrent vaginal itch and burning, the vulval itch and burning. These symptoms are worse when you're overheated, and that means that you'll notice the symptoms more overnight when you're in bed, and that can interfere with sleep. But you can also find that your symptoms make intercourse uncomfortable, and that in itself can be distressing. Often women are diagnosed as having thrush with an itch or irritation. It's just an assumption based on the fact that thrush is the commonest vaginal infection. I've had a number of women who have been told that they've had thrush when they've actually had some sort of vulval or vaginal skin disorder, which is not an infection. So it's often overdiagnosed and it's just assumed that thrush is present if someone has an itch or irritation. Recurrent thrush is especially common if you are diabetic, you have an immune deficiency disorder, if you're using broad spectrum antibiotics, And also being on the pill increases the incidence of thrush. The thrush germ grows especially under the influence of estrogen hormone. So if you're pregnant, you're more likely to develop thrush because of the estrogen hormone produced by the placenta. If you're having problems with recurrent thrush, or you find your thrush is not being eradicated as you would expect, it's important that you come along and make an appointment to see us so we can further investigate you. We can make sure you don't have an underlying cause. We can take the appropriate swabs and ask the laboratory whether or not the treatment is going to be a problem because of resistance or whether the germ is sensitive to treatment. And then we can put you on an eradication program to ensure we totally eradicate the germ and prevent recurrence.